Often the second opinion just confirms the fact that the patient is being treated appropriately, and I think that's very valuable to families, and it gives the parents a sense that they have more control over what's actually happening with their child, and they've actually actively participated in the treatment decisions, especially at the beginning, which is the most critical time for pediatric cancer patients.
It's very easy when you're in a desperate situation to want to go out and get as many opinions as you can. So that complicates things, obviously. When you have different opinions, then it makes it even harder to decide, well, what's the right thing to do? To me, the thing that drives a patient referral is really what the family wants to do. But I really want the parents to feel good about their child's care.
When a cancer returns or recurs, it's obviously a very difficult time for a family and their physicians as well. What's most important for a family to know is what's the best option for my child. And that's where the Children's Hospital of Philadelphia can often lend a hand in both providing reassurance as well as providing a range of options for difficult to treat situations.
When a child is initially diagnosed, CHOP has a great deal to offer. We can appreciate the diagnosis and draw up an appropriate treatment plan in a very short time period. We have a very active developmental therapeutics team, and often we'll have access to the newest therapies that other practitioners may have thought of and considered but might just not have the access to.
We have specialists in each area of disease, and we'd like our children who come for second opinions to see one of our experts in the disease that that child has, so that the opinion that they get is thoughtful and rapid and of the best quality possible. We can partner with the primary oncologist in helping the family, make sure that the therapy that the child's getting is in fact the best thing for them, and if there are any options for the future, what those might be.
Those with more complex diseases or more rare cancers, I think, are well served by referral here because of the large experience here. Even for the most rare pediatric cancers, there tends to be at least somebody here who's seen a number of cases of that and is able to make some informed and experienced treatment recommendations for those patients.
It's an important point to make that the referring physician remains the center of the treatment team. I mean, we are a consultative service. We respect the long history that the referring physicians often have with their patients and their families. And that's made clear to the families when they arrive here at CHOP, that we're here to help, not to supplant.
It's not about egos, it's not about who's higher on the totem pole, it's about working together as a team. That's the emphasis, and the kids are always the emphasis. This is how it's supposed to work.